Numbers have driven decisions for nearly 2 years. They indicated where cities stood and where they were headed. For applied mathematics Dr. Daniel Larimore,
it's been a curse and a blessing.
Larimore is a CU Boulder researcher. He and his colleagues recently published a study that found testing only unvaccinated people in highly vaccinated communities had little impact on community spread because there are so many breakthrough cases.
As vaccination rates go up, there are more vaccinated targets for the virus to try to infect. And so at some point we see a crossover point where, in fact, 50% of the people who are infected are vaccinated, 50% are unvaccinated. Testing only the unvaccinated is going to be low impact. But if we know that there are plenty of breakthrough infections, it may be better to test everybody, not just those unvaccinated folks.
Demand for testing is another surge Colorado is seeing. According to CDPHE, its 150 free community test sites average 11,000 tests per day. But during the holidays, that volume peaked at 20,000 tests per day. Larimore says with at-home rapid tests often being the first line of defense, he expects positivity rates to increase.
More of the people who get in line for that PCR test are likely to be positive. Fewer are likely to be negative. This has the effect of pushing up those test positivity rates in the PCR lines.
Positivity rates in Summit County have officials warning all to be cautious. The 7-day average went from 7.5% to 24% in just a week. Boulder County's 7-day average also increased by 160% in 1 week. Regardless, the best thing anyone can do is get vaccinated.
Do your part.
Larimore says it's what keeps most COVID-positive people out of the hospital, and the numbers prove it. Jaleesa Rosari, 9 News.